We think of claustrophobia as a fear of small spaces, but is that what's really going on?
Let's dive in. Often, the real issue isn't about the space itself, but a need to feel in control.
Anxiety really comes from uncertainty, so let's turn those what-ifs into actual, answerable questions.
The first thing that can cause anxiety is just not knowing what's going on, moment to moment.
That's why, in a medical setting, info is made visible. You're never left guessing what's happening. And what about time? Yeah, losing track of how long you've been in there can feel really unsettling.
So having a visible clock or a timer is key. It helps you stay grounded and track the progress.
But here's the big one, probably the most important question. Do you have the final say?
And this really gets to the heart of it. Knowing you can pause changes everything about the experience.
A simple hand signal is all it takes to pause the session. You are never, ever trapped.
So let's check out the safety systems that are specifically designed to empower you, the patient.
It all boils down to these three things working together, making sure you're connected and in charge. This is why so many chambers are clear. It completely removes that feeling of being isolated.
Plus, with a two-way intercom, you can ask a question or just check in whenever you need to. And just understanding how all this works beforehand is a huge part of feeling at ease.
These things aren't just paperwork. They make sure everything happens with your full understanding and consent.
Of course, different procedures use different setups, but safety and supervision are always the top priority.
So here's the takeaway. When you focus on control, it can completely change how you experience that space.